And Marcin, if you could please call the roll.
Steve Hernandez.
Here.
Greg Ritter.
Here.
Paul Philpott. Victoria Beltry. Paul Lombardo.
Here.
And CC Woods.
Here.
Thank you.
Thank you, Marcin. Could the staff also introduce themselves, please? And welcome,
Sure.
everybody.
Thank you. Thank you much, Mr. Chairman. James Michelle, CEO of Access Health Connecticut.
Hi, everyone. Tony Crow, Chief Operating Officer at Access Health Connecticut.
Hi, good afternoon. Daryl Jones, Director of Finance, Access Health Connecticut.
Hi, everybody. Susan Richby, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good afternoon. Caroline Lee Ruette, Director of Marketing, Access Health Connecticut.
Good afternoon, everybody. John Carbone, Director of Shop and Product Development, Access Health.
Thank you, everyone. And if that is everyone from the staff side, yes? Oh, Vicky, have you just joined us?
Yeah, I joined you. I'm sorry, I was a couple minutes late, but I'm here.
Nice to see you.
Hello.
I'm sorry, I was on mute. Tammy Hendricks, Director of Health Equity and Outreach. So sorry about that.
Hi, Tammy.
Can also add Marshall, the Health Key Governance Specialist. Mr. Chair, there is no comment.
Thank you so much. And I think we should probably dispense with the motion on the minutes so that we can vote on the minutes for March 17, 2022, the Strategy Committee special meeting minutes. If we could have a motion from the floor.
I'll move it.
Thank you, Vicky.
Seconded, Grant.
Thank you. Did everyone have the opportunity to review the minutes, and is there any discussion? Hearing none. Can we have a roll call vote, Marcin?
Yes, Mr. Chair. Steve Hernandez.
Yes.
Ritter.
Yes.
Paul Philpott. Victoria Beltry.
I'm going to abstain. I think I was not at the last meeting. I apologize.
Paul Lombardo. And CC Woods.
Yes. Whoops.
Thank you. I'm wondering if Mr. Paul Lombardo is available to cast his vote for the minutes. I believe not. Thank you.
All right.
Okay, thank you. And I know that we have a robust presentation and update today. So without further ado, I would like to hand over the conversation, the lead, to our leader, James Michelle.
Thank you very much, Mr. Chairman. You know, you're gonna get an update on the Broker Academy, and we are fully staffed, and we have 100 individuals. Again, representing the demographics that we are looking for to help address health disparities in Connecticut, and also help us out with other initiatives going forward as well. I think Tammy's going to give you a full update on where everything is at this point, and we are ready to rock and roll on June 1st. And also, Tammy, if you would to talk a little bit about the grants that we have applied for to help support the work for the Broker Academy. Tammy?
All right, good afternoon, everyone. Tammy Hendricks again, Director of Health Equity and Outreach. We have some really exciting updates for the Broker Academy. You know, the program start date is fast approaching. Classes begin June 1st. And so I also have some updates on the numbers from the slide. So things are changing on a daily basis sometimes with the Broker Academy, which is, it's all good things. To address the grants that we've applied for, before I forget, as I go through the presentation, we've applied for a grant at the beginning of the program from the community, from Connecticut Health Foundation, and we received that grant for $25,000. We then pursued a second grant from the Health Foundation, requesting a larger sum of money. I actually don't remember the amount, but we are in the works with them. We have answered a few questions, so we should be finding out fairly soon if we've received that larger grant from the Health Foundation. They've been great partners with us before, so we're looking forward to having them help us move the program, the second half of the program along. We've also reached out to the Fairfield County and applied for a president's discretionary grant through them. And we also put in a grant request with Career Connect. So that is down in, I believe, Bridgeport. And if that grant comes through, that would actually fund all 4 years of the Broker Academy, which would be fantastic. So we're still awaiting, to hear back from all of those organizations in regards to the grants, but those applications have been completed. And so we just await the results. So all good things there. Moving on to the actual presentation, as I said, classes are coming up June 1st, fast approaching start date. So applications closed on May 2nd. We had a total of 171 applicants, really surpassing the initial goal of recruiting 100 students. This just really speaks to the tremendous effort from the team promoting the program, right, through presentations. We've done events. And of course, our community partners really coming together and working with us, referring a lot of great applicants. Some of those applicants are community health workers. Some of them are CACs that work with organizations that we partner with. So it's just been a really great collaborative effort to recruit all of those students. So 100 students have been accepted. They have their background checks completed. They've signed offer acceptance letters. We currently have 9 students on the wait list. And all of the students have been so enthusiastic about the program, really thankful for the opportunity. The application implementation team did a wonderful job on all of the interviews. We did over 120 interviews collectively. And we really enjoyed hearing from the students and hearing about their background and how beneficial this program is going to be for them and their communities that they're from. So really great things there. That application process really grounded me, for one, when we got to speak with the students directly. So, but to keep the students engaged, of course, this was kind of a long application process. We started in around February. We have our pre-training implementation team, and they've set up weekly Zoom calls. So as we accept students, students are invited to these weekly Zoom calls where they cover different topics every week. I think the first week was health equity. Then we had the shop team come in. Then we had broker support speak. So, but also during those sessions, we're answering any questions they may have about the program and what to expect. So very engaging. That team actually set up a separate page for the students, created a wonderful welcome video with a few Access Health staff, with the president of the Connecticut Health Foundation. She had a welcome for the students. So if you haven't had a chance, check out that page. Really good stuff. The team did a fantastic job putting that together. On top of that, they're also posting the previous presentations on that welcome page. So if students don't have a chance to get to the Zoom session, they can go and look at the past presentations on the page. The pre-training team is also conducting surveys about, class locations, which location the students would want to attend, really just gathering information for us from the group so that we can better plan the training portion and the mentorship portion. Of course, we have 3 locations, so we want to make sure it's kind of evenly distributed. So we're working towards that, and the surveys are going to help us plan for that. So moving on to training.
Hey, Tammy, can you remind the board, the committee about the location of the three training locations?
Yes, sure.
Okay.
So we've secured 3 locations, and we really partnered with community colleges only because they are well known in the communities. Obviously, they're on bus lines, so they're easy to get to. So the Hartford class will be held at Capital Community College. The New Haven class will be at Gateway Community College, and the Bridgeport class will be at Housatonic Community College. So they've been really great partners. We partner with them for outreach events as well. So it was really a great collaboration for us to be able to host our classes there for 3 days. James? All right, so, moving on to training, the contract for Kaplan is finalized. Kaplan will be providing all of the training materials and resources for the students. This includes setting up, we're actually working with them now to set the students up with an online portal. And the students will actually have access to all of the training materials offered on this portal for 6 months. So we are in the process of working with them now, and I think they should have all of the students up and running about a week before class starts. So they'll have some time to kind of go in and look around on the training portal. So just a reminder, the in-person training is set for June 1st to the 3rd. And during this time, we'll actually be able to distribute the laptops that we have. Our IT team has done such a great job. They not only had to clean the laptops for the Broker Academy, 100 laptops for the Broker Academy, but we're going into, our staff is exchanging their old laptops, and so they're setting us up with new ones at the same time. So it's been a tremendous effort.
So, hey, tell me very quickly, for the committee, we had regularly, every 3 to 4 years, we have to update our laptops. So this was a regularly scheduled on a laptop update. So it just so happened that we have them available. So we're gonna clean them up, making sure they look presentable, excellent quality, and distribute them to the students. If we didn't do that, then we have to keep them in the closet, eventually find a way to get rid of them. This is a win-win for us because if you have a ton of laptops that accumulates in your closets at home or in your basement, you know how cumbersome that could be after a while. So now we're able to repurpose them, and we have our IT team has volunteered on their own time in the evening, on the weekend to refurbish them. So they will look very presentable, very functional for the Broker Academy candidates. Thank you.
Thanks, James. So, just wrapping up here, we have the 3-day training, June 1st, 2nd, and 3rd at Capital Community College, Gateway Community College, and Housatonic Community College, but the remainder of the program will be virtual. So again, they'll have access to all those resources, study guides, practice tests through the Kaplan portal, and they'll have access to that for 6 months. But the plan is to have all the students by the end of July sit for the state exam so they can start the mentorship portion of the program in August. And that way they can have 3 months of training before open enrollment starts. So everything is on time. We are moving forward. Our teams have been working extremely hard and it shows because the program not only brought, employees together, but also our community partners really collaborated and helped us every step of the way as we were standing up this program. So we're really looking forward to the in-person training for the students. But that's all the updates I had, unless you think I missed anything, James?
No, I mean, I think
Caroline?
we'll open up to any questions from the committee members.
Sure.
None for me, and I don't see any hands raised. I think it's just so exciting, I think, to see the constant movement and evolution of this work and how you're so committed to expanding its purpose. So just congratulations. And, at some point I feel like there's a celebration, or at least a celebratory exposition to be had when you're ready. So I really feel that the time will come for that.
Yes, absolutely. The teams, everyone that's working on all aspects of Broker Academy are doing this on top of their full-time positions, right? And they have dedicated the time and effort, and it really shows. Sorry, my phone's ringing off the hook. And it really shows. So we're really excited to see it all come together like this. And the next big portion is the mentorship portion of the program. And that team has been working very hard to put that together. So everything's moving along on time, on schedule, and even better than I expected. So very thankful for our team.
Thank you, Mr. Chairman. Again, Connecticut has 5.4, 5.5 uninsured rate, and we are dealing with the hardest to reach population, and maybe half of them may be Medicaid eligible. The other half would be customers for Access Health, but they live in those communities where there's a dearth of brokers, access to knowledgeable people in their own communities. We think this is going to be very helpful in bringing those folks into the fold of having health insurance. Because right now they have nowhere to go if they need if they have a question, they have no one to turn to. So we really hope that by having 100 trained, licensed health insurance brokers in their own communities could be helpful in helping solve those problems, but among other problems as well.
And one last thing to add, Daryl just reminded me, we did apply for funding from the city of New Haven as well. So we'll be probably finding out about a lot of grants at around the same time, which would be a really good thing anyways. But yes, lots of hard work put into those grants. So we'll be finding out within the next month, I believe, on a majority of those.
One final comment on that. We have a detailed project plan for the Broker Academy. We broke it up in small chunks, and we have we solicit volunteers from the employees for each part of it. And so right now, as you indicated, Mr. Chairman, this is morphing, this is evolving, and every time we take a step, another team is taking ownership of that step and moving forward until we complete the whole process. And we also have a team after everything is done that's going to do follow-up with these licensed brokers to make sure they're moving forward and answer their questions and help guide them. So this is the entire organization is really pitching in. And also they're very energized, very, very excited about doing something that's making them feel good about what they do. So it's worked out very well for us as an organization.
Yeah, I agree.
Thank you both.
Thank you.
So, hey, Tony, you want to talk a little, give a quick update on where we are with the subsidiary?
Sure. Hi, everyone. Not too much has changed since the last time. If those with a sharp eye will notice, some of these dates were moved out a little bit more as far as putting the subsidiary together, but I think we got a little too aggressive on moving them out. We're going to be ready much sooner than what it shows here for you folks to see things. The only two things left to do right now are we have a financial model, but we need to tweak revenue and expenses so we can have a more accurate estimate for you folks. And we also, yesterday, we made a lot of progress on naming the organization. It's a multi-step progress and multi-step process rather. And we should be done with that by the end of May. So all of these dates are a little too far out in the year. That's on me. I should have tightened it up a little bit more, but we're looking forward to presenting what we have in mind, and you should be seeing it very soon. It'll just depend on when James and Stephen want to schedule a meeting for it, but we should be done, wrapped up by early June, as far as the committee is concerned. And the committee is made up of Susan Richby, Daryl Jones, and Margot and myself. And really, that's all I had for today.
So, Mr. Chairman, we in committee members, we are looking to bring a draft to this committee at the June meeting. But Steve, I will send you a final draft for your review, before we schedule anything. I know I sent you a high draft a while ago, but we do have an updated draft with more information. And the financial projections is the area that I had a lot of questions on, and that the team is looking at it again and refining it. And so once we get that in place, and we'll also bring to this committee a draft name for the for your review and approval. Then we'll take it from there. Again, we're moving very deliberately and very strategically to get this in place down the road to address some of the structural challenges that's impacting individuals' ability to maintain and manage their health.
Great.
As we've talked about, the multi-generational households are really impacted by some societal challenges for moving forward.
And I just want to point out, it's probably obvious to everyone, but the Broker Academy and this initiative are going to work very well together, because the products that we want to market are to the audiences that the Broker Academy will be in. So when they get some experience under their belt, we're going to have some built-in advocates for some of the products that we want to put on the subsidiary. So I think they'll work very nicely together.
Great.
But I'm happy to take any questions if anybody has any.
Not seeing any hands raised. Thank
Okay.
you. Thank you again, Tony. You know, what's really striking is what you said, James, which is this multi-generational impact, especially among those members of community that are emerging or members of community that have faced intergenerational poverty. So you're reaching into where you can really have the most lifelong impact on families. So thank you for that.
And also one of the natural customer base are the undocumented folks that don't have access to any financial services, including purchasing health insurance. They could buy health insurance now, but no one's marketing to them. Right. So the subsidiary will be a place where the communities that are ignored by insurance companies, banks, and other kinds of services companies, we're gonna, again, Vicky, at a very high level, the plan is to design products and services that are specifically priced and designed for their needs. So they're not gonna have any bells and whistles. It'll be something that they need for where they are today, and hopefully over time where they could grow and evolve. Right now, imagine all the folks last year who received the advanced child tax credits. A lot of cash is coming in, and they don't even. Most of them did not have anyone to turn to. Hey, what do I do with this money? You know, where do I go with it? Right now, there's no place for them to go, and banks ignores them because when they show up, they don't have a regular job paying them steady cash, and where there's direct payments into their payroll, into their checking account every 2 weeks. Banks don't have products to help them. If they do, it's very expensive for them. They got very high fees on because the minimum balances. So we are looking at the comprehensive approach to help deal with the generational poverty that expands every generation. The circle gets bigger. And so the goal is to how do we design products and services that to help pull people out of poverty, long-term strategy. Yeah, we think right now there's a lot of help available to help people when they hit a snag in their life, whether it be food, whether they need rental assistance or they need money to get food. But we're talking about the long-term strategy to help address some of those challenges.
Thank you.
Okay. I think Susan is up, right?
Yes, thank you, James. Hi, everybody. We just wanted to provide you with a brief update on the work that we've been undertaking for the last many months on making some changes to the advisory committees. So as this committee and the board voted, we expanded the Consumer Experience and Outreach Committee to now be known as the Health Equity Consumer Experience and Outreach Committee, and also dissolved the brokers, agents, and navigators, and are folding in those interest groups and membership into this committee and other committees. So since we last met, we have met with the committee chair for the new committee and to talk about new members for the expanded committee. And during April and May, we are conducting outreach to potential candidates identified for the committee. You know, some of the areas we were looking at are people with experience in the health equity space, and also to bring in that navigator component that was previously on brokers, agents, and navigators. And so our plan is by June to be able to come to the board for a vote on new members for the committee. And there may be some people who have been on the committee who will no longer be serving on the committee. The board has to actually vote to remove them as well. So we'll take care of all that at the June meeting. And then the hope is that we'll get everything ready for the expanded committee and new members to do a kickoff meeting with the new focus starting in September. And that'll really tie in well to some of these initiatives, obviously, that James and Tammy and Tony have been speaking about as well. So that is where we are. If anyone has any questions.
Susan, can you mention who's the chair of the new committee? So that
The chair is Ted Doolittle, who was the chair for the committee previously. So we have been meeting with Ted. Sorry, I didn't mention his name, to work on this. So he's had some great, suggestions and ideas for us as well on new members.
That's great. Thank you, Susan.
Okay, let's move on. If there are no questions, we can move on to the next slide. So I think Tammy, Caroline.
Yes, good afternoon, everyone. We had spent some time prepping you with some information that we're going to reshare again today, and I think there's some votes to be taken as well. This is about our mission, vision, and guiding principles. As a refresher, these were things that were adopted by the board more than 10 years ago at this point in time, or about 10 years ago. We've done a lot of evolution as a brand, and so it's time to take a look back, figure out, what's still relevant here, what might need to be changed to better reflect who we are and where we want to be. So we took an internal effort, as a reminder, with all of senior leadership, really dissected what existed, reworked what we thought didn't necessarily apply to us anymore, and shared that with you. We're going to go through those suggested revisions again today and then take a vote. We'll go one by one. Mission and vision will be fairly quick, so we'll start there, and then we'll separate for guiding principles, which are a little longer. Thank you, Martin. So as a reminder for what a mission is, it's what the company is right now today. So please keep that hat on as you're looking and listening at our suggested revision. On the next slide, please. Excellent. So the statement adopted in 2012 is to increase the number of insured residents, improve healthcare quality, lower costs, and reduce health disparities through an innovative, competitive marketplace that empowers consumers to choose the health plan and providers that give them the best value. As a reminder, we thought there's a lot that's still good here, right? We are incredibly connected to our mission. All of the work we do is really rooted there, and we reflect on it regularly. So we made some slight modifications for your voting pleasure here. And so that is to decrease the number of uninsured residents. So a slight just change in how we're talking about the uninsured. Improve the quality and affordability of healthcare. So a small change there with affordability. We thought that better reflected where we are today. And reduce health disparities through an innovative, competitive marketplace that empowers consumers to choose the health plans that give them the best value. Again, a lot of that second part is exactly the same, so the modifications here are slight. That said, this is incredibly important for us as an organization as we consider revising that. So we want to pause here and see if there's any questions as it relates specifically to the mission and our suggested revision.
Vicky, you're probably the most senior person on this committee. I don't know if
Yeah,
you
in more ways than one probably, and I don't even want to say.
And I'm not, Vicky, I'm not talking about your age either, Vicky. All right, let's be clear about that. But I don't know if you remember I don't know if you were part of the process that led to. So again, minor modifications, just clarifying. Now that we've moved on from the insured residents, now we have to lower the uninsured residents.
I like it.
I think we made a lot of progress, but now we have to continue. It gets a little more difficult. It's like going from a B to an A. Going from a D to a B is very easy. Show up to the work, but going from a B plus to an A, it gets very hard because it gets a lot more challenging, more complicated. So we're trying to get to.
Great. Now you guys have to find. This is the hardest to reach population.
Yeah, absolutely.
Now, so
this is why we think the Broker Academy, having folks from those communities trained and licensed, could be very helpful in helping us tackle this part of the mission.
I want to make sure there's time for folks to provide feedback. Was there any questions or feedback before we move to the vision statement suggestions? No hands? Okay, we can move on. So to ground ourselves again in the definition, a vision statement is what we want to be like in the future. So we get to put our future hat on here. So Martin, go ahead and advance the slide. Thank you. Okay, so where we were at back in 2012, it's the CT Health Exchange supports health reform efforts at the state and national level that provide CT residents with better health and an enhanced and more coordinated healthcare experience at a reasonable, predictable cost. We made slightly more modifications, I would say, here than our mission to better align with where we are. Obviously, we've made a lot of progress in the last 10 years, so I think that the clarity is there for the next 10, 20 years or so. So our suggested revision is to provide Connecticut residents with access to the most equitable, simple, and affordable health insurance products to create healthier communities. Give everybody a minute to think on that one and see if there's any questions or comments.
So I guess my only comment on this one might be, even though we are selling QHPs, or like we're enrolling people in QHPs, we're also helping Medicaid patients access healthcare and other stuff. So even though, I think it's right in what it says, but do we wanna, should we say healthcare products, or I don't know, like, what do other people think? Maybe I'm just overreading it.
Well, not Vicky, right, Vicky. Health insurance products imply we only do commercial products. All right.
We could say health. Sorry, James.
As a matter of fact, DSS is probably the biggest health insurer in the state of Connecticut. With 300,000, actually almost 800,000 Connecticut residents. Maybe we take another look at that instead of using health insurance. Come up with a more generic nomenclature, if you will. That'll be maybe slightly higher above health insurance as health care products. What were you about to say, Susan?
Sorry, James. I was just going to say maybe we just modify it to say access to the most equitable, simple, and affordable health coverage products. I don't know if products is the right word, as Medicaid and CHIP are programs, not products, but maybe we tweak that, but say health coverage. Okay. Or access to the most, equitable, simple, and affordable health coverage to create healthier communities.
How does that sound, Vicky? Is that a little bit better, more inclusive, if you will?
Yeah, I think so. I don't know what other people think. Don't make it my decision only.
Well,
Other people
yeah.
want to
No,
weigh
Vicky,
in.
yeah, no, Vicky, this is why we do this, because we spend a lot of time on this, looking at it from our very health insurance focus, but by having collaborative input, we get more clarity.
Well, the thing is, like, it's totally the QHP thing. If you took out like, it's almost like you could say provide Connecticut residents with the most equitable, simple, blah, blah, blah. Or if you're saying access, then I think it's broader than,
Mhm.
because we have access in there, it feels like maybe we should be broader. But
Yep.
This is Cece. How are we defining equitable? Because I'm looking up at reasonable, predictable costs, which we tried to do. Is that a stand-in for that, or what is equitable in this context?
It's a great question. I'll take a first stab. I moderated a lot of the discussions here. So when we inserted the word equitable, and Tammy, I hope that you would chime in too with your feedback, since it does speak more toward the second part of our mission, right, which is to reduce health disparities. So we want to make sure that the access that we're creating, or the insurance products, insurance coverage, all of that is up for debate here. What we're offering is equitable to every Connecticut resident, meaning for everyone, right? Not just certain community groups, depending on, the socioeconomic factors, amongst others, really making sure that it's inclusive for every single Connecticut resident. Does that help, Cece? And Tammy, do you have anything else you wanted to provide as context?
No,
Yeah,
well,
it does. It does. Yeah, all right.
Good dialogue. Helpful.
And I guess I get the affordable, which is replacing the reasonable, predictable cost. Yes, that we're striving for affordability within our power.
Correct. Someone again, we have some limitations about predictable costs, because we don't approve rates, and we don't approve, we don't control what hospitals and doctors charge, as well as pharmaceuticals. But affordable, I think we could do something on the affordable side in terms of designing health insurance plans to be sold on the exchange.
Right.
That part we could do, and also help address equitable by ensuring that all the plans have cover certain benefits that helps everybody. And also, we have we have requirements that they have to have hospitals and hospitals and certain level of healthcare providers within certain jurisdictions. So that's the equitable part comes in, that we actually could do something about that by requiring that they have hospitals and pharmacies within certain mileage and distance of certain communities.
Okay. And we do have a much higher standard on the essential community providers. We require a much higher percentage of ECPs in the carrier networks, and have done that for a long time.
Right.
So I think that also helps support that equitable strategy.
But the cost component, we understood initially, because the whole intent behind the ACA was to try to control costs. But as an exchange, again, because the insurance department approves premium rates, and then and I'm not sure who controls costs that hospitals, doctors, and pharmaceuticals could charge. I suppose the insurance companies have some control over that through negotiations, with contract negotiations. But again, those are beyond our reach, if you will.
Yeah, it's either contract negotiations, or or the
Mhm.
state in the case of Medicaid, or federal
Yep.
government in the case of Medicare. We can't control those prices.
Yeah,
We could, but we don't. Put it that way. We could, but we
Well,
don't.
at least not now, Vicky. Not yet, anyway. I'm sorry, Paul.
yeah, this is Paul Lombardo. The only comment I would have is affordability is extremely subjective.
Yeah.
And it's hard to define, right? As I think we've struggled for as long as I've been at the insurance department, which is way too long. So I would just, if you're going to include it in there, I would try to have some general definition of what affordable is, which is going to be difficult. It's not easy to do.
Yeah, Paul, this was a big part of our deliberation inside. How do we define affordable? Because
Right.
for Vicky it means one thing, for me it means something different. So,
Yes.
again, this is what we included in our vision and our mission, because we aspire to get to that level. And maybe every year we'll look at refining it even more and more. But Paul, we will go back and take another look at that.
Yeah,
And-
just I think, James, it would be good to try to develop something where, to your point, if you're looking at it on an annual basis, if you're trying to strive to affordability, there has to be some definition of it and some goal that you're trying to achieve.
Mhm.
And if there's a way to capture that, you win the raffle prize because
Well, Paul, we know the ACA affordability in terms of premium.
Right.
It was 9.5%. Now it's down to somewhere around 8%.
Right.
Again, this is just in terms of premium.
Right.
But we know healthcare is a lot more than just premium.
Right. Cost sharing.
Copay, deductible, and so forth. So
Yep.
It's an all-inclusive basket. So maybe there's some way to come up a total percentage of your healthcare costs, including premiums, should not be above a certain amount, whatever that's going to be. So we'll continue to look at that.
Great. Thanks.
I
The
was
only
just
thing
going to add, I think,
Go ahead.
I'm sorry.
Go
Just
ahead.
given that this is the vision statement for the future, what we wish to be like in the future, I think this is, a good way to focus on, as James mentioned, coverage or affordable coverage options for people who are undocumented, and all of Vicky's good work on Covered Connecticut, that we're going to keep focusing on bringing in these new initiatives, into the exchange to provide access, really, to serve as a conduit to provide access to all of those different options for people.
Thank you, Susan.
Perhaps-
The only thing I might add is the notion of creating healthier communities. There's more of a fostering healthier community, maybe invest in healthier communities, but the creation of a healthier community, it leaves out the idea that it's a two-way street. It's an investment, it's an opportunity, it's a equitably accessible opportunity to being healthier and to engaging in your own health. So I'd love to see more two-way.
Okay. Vicky, were you about to say something?
Nope, just nodding.
Okay. Thank you.
I just wonder if we put in the word more affordable health insurance, because we can't just come up with affordable, but we can certainly strive toward more affordable.
Okay. More affordable health coverage, right?
Right.
All right, we're taking insurance. Okay. Okay.
So I think there's a little bit more work to do here and to come back if I'm hearing that right. And so perhaps we do that rather than taking a vote. Is that what I'm understanding?
Yeah. I think we need to adjust this. Come back. Okay.
Yes.
All right. Just wanted to make sure before I moved on, since we were originally planning, which is all good. I think we can move on to the guiding principles and have a similar discussion. These are a little longer. And these are foundational statements adopted by a company to guide decision making. So again, keeping that decision making hat on, I think, is important as we're evaluating this. And you can go ahead and advance the slide, Martin. Excellent. So there were 4 foundational statements or principles adopted in 2012 for Access Health CT, and they are as follows: an exceptional consumer experience, sustainability, flexibility, and transparency. So when we originally looked at these as an SLT group, two things kind of stuck out. One, 3 of them are singular words, 1 of them's a phrase. So just in terms of how we're approaching this seems to be a little bit different. And, really defining what those 3 words mean, right? Sustainability, flexibility, and transparency is a little ambiguous. So the way we approached our suggested revision for you is to really ground that in a lot more context. So let's walk you through that. Go ahead and advance to the next slide. Great. So all of the legacy content that you saw on the previous slide is in yellow text here in the bullets. So really what our discussion was around is that these things we felt still applied, open to healthy debate there, but we wanted to wrap those around in context. So here's a little bit about how we suggest that we revise the actual foundational statements. But I will also let you know that we do have follow-up slides, and we plan to, make that information available too when we're talking about our principles that provide some more definitions about what we mean by certain words. And so that was kind of what we were talking about, right, in our vision statement. And so I think there's some more context here that will be helpful for the group too. So without further ado, the suggested change we're making to the first one is to provide Connecticut residents with an exceptional consumer experience, promoting accessibility, integration, and health equity for all. The second, we decided when we were thinking about contextually what sustainability and flexibility meant, we decided that they kind of lived together when we had some context to provide. So that now reads in our suggested revision as maintain a valuable place within the state's healthcare ecosystem for the benefit of Connecticut residents with a focus on sustainability, flexibility, and affordability. So we'll get to another slide where we took a stab there at affordability, and I think that will be a healthy discussion. But nonetheless, those were the 3 things that we really felt lived together, 2 of them being legacy and another one being some added new contextual information. So the third, about transparency, we decided to wrap in this context. Uphold transparency through accountable communications with Access Health CT stakeholders. And again, we've got some follow-up slides on what transparency, accountable communications, and who stakeholders are. I assume that those would be questions. And then the last, we really felt like this was missing. This was something new that's kind of come along with our evolution, and that would be to seek Access Health CT values-based input from employees. I think everyone on this board has really been along that journey with us over the last couple of years, defining what those values are and making sure that they're integrated in every part of what we do. And so we certainly felt like they deserve to be a part of how we make decisions, really including that values-based input across all levels of Access Health CT. So I'd like to transition to a couple of the extra slides where we talk about the definitions before we move into discussion. Martin, can you advance the slide, please? Thank you. All right, so here's some more context about the really important keywords that we're including since we're adding new context to these guiding principles. So that first one about providing Connecticut residents with an exceptional consumer experience, promoting accessibility, integration, and health equity for all. What do we mean by those 3 big things? In terms of accessibility, we mean to strive to reduce the number of residents without health insurance and improve access to healthcare for all residents. Integration, we mean integrate public program information to ensure continuous healthcare coverage for Connecticut residents and seamless transitions between public programs and qualified health plans. I think that speaks a little bit to some of what we were, our previous discussions were in terms of the vision, which I find interesting here. And then health equity for all, work to address long-standing unjust disparities in access to healthcare in Connecticut that influence health outcomes. It's a lot to digest, I think we can take kind of the context that we're wrapping, all of these new suggested guiding principles into account one by one. So I'd like to pause here for this very first one, and then we can kind of take them as they come. Do we have any comments or questions in terms of the definitions we're providing for the keywords, or whether or not they even belong in our revised principles?
This is Paul Lombardo, and I apologize because I'm at a loss for what is the difference between disparities and unjust disparities, and I apologize for not understanding that.
Yeah,
I would
it's
think
an
most
apology thing. I
disparities
think
would be
yeah.
right.
Okay.
I would think we wouldn't want any disparities in access to health care, right?
Right. Unjust or justice. All
Right.
just.
I mean, again, it's in the eye of the beholder of what is just and unjust. I wouldn't want to muddy the waters with that. I just won't. I wouldn't want any disparities within access to health care.
Right. So, Paul, our thought process was along the undocumented folks. That's why.
Yep.
That's why that. But yeah, your point is well made because we got so caught up in the language. Just disparities covers everybody. But in some corners of America, unjust disparities means undocumented folks.
Okay.
So that's why. But your point is in a much higher level, and I don't think we need to narrowly define it as such. Just health disparities. Period.
That's why I prefaced my comments, James, with me not understanding that, and I'm glad you shedded light on that for me. Thank you.
That was our thought process. We want to be more inclusive.
Yeah.
And maybe by doing more inclusive, we maybe excluded some other folks who are not undocumented. And this is why we have these meetings, so people will see for the very first time, give us a perspective that we're not able to see because we were caught up in it for days.
Yeah.
And
I get it.
The editing. So we appreciate the input.
Yep. Thanks.
I even read it differently from that. I read it as intentional versus unintentional, maybe, or like, there are no just disparities in my,
Right.
I agree. There's no just disparities, but there are disparities that are intentional. So I think probably also I would recommend removing unjust.
And Vic, one example of intentional disparities excluding undocumented folks. That is with the purpose of excluding them. That's in the law in the ACA.
Right, or racism. I mean,
Yeah.
let's just face it, right?
Yeah.
So,
Okay.
Any other comments or questions about, diction or syntax here across the suggested revisions and kind of our definitions of those keywords? All right, we've got 3 more to go, I promise. We'll get through it. Martin, can you advance the slide, please? Okay. So this is all about transparency. Uphold transparency through accountable communications to access health CT stakeholders. So in terms of accountable communications, we're approaching that from the meaning of ensuring that business activities are shared transparently, services are easily available, and information being easly understandable.
Now,
and who are our stakeholders? Go ahead, James.
For the accountable communication, we have you may have seen within Rob's presentation, we've invested a lot of resources in making our technology easier to use and making sure everyone could understand what they're seeing on the screen. And we are also working to reduce the number of notices people get in their homes from Access Health and DSS. And that's resulting in some savings, operational savings from printing and postage and envelopes. But the intent here is to meet this definition of accountable communications.
It even transcends language barriers, right? We
Right.
translate a lot of our information into other languages so that residents can digest it where and how they understand it. All right. Moving on to stakeholders. Key stakeholders include the public, our board, insurance carriers, state and federal legislature, and state and federal-based agencies, brokers, community partners, and employees. Very broad. Lots of folks we're dealing with, lots of hands in this cookie jar. Comments, questions as we're digesting this?
You want to say employers too? I mean, just a thought. For the shop,
Yep.
I guess they're in the
Yeah.
public.
Yes, they are. Well, the employers,
No, it's good.
the employers.
James, in
Yes, sir.
this new company, are you're not going to offer shop, are you, or are you?
The subsidiary.
Yeah.
Yeah, we're still wrestling with that, with how that's going to play out, because
Okay.
we think we're going to have a platform that's going to make it as easy as possible, to make it easier for those who are currently being ignored
Okay.
by by financial service industries. If we combine it, if it'll be more affordable and easier, yes, again, we are exploring that. That's why one of the items on Tony's Gantt chart was looking at defining a platform
Right.
for the subsidiary. And so, again, that's part of the process. If it's more efficient, more cost efficient, that's what we'll do.
Okay. Thanks.
Mhm. Okay.
All right. Moving on here. This one, did we skip one, Merchant? Go up one more time. No. Can you reverse the slide? I think this is our last one of a couple. One more? Oh, maybe not. All right,
Okay.
I'm sorry. Please go back down to that slide. My apologies.
It looks like 20 and 21 are identical.
Thank you. I must have misplaced the slide. Thank you for that. Okay, so this is the last one that we're suggesting, which is to seek Access Health CP values-based input from employees. And so we have our values clearly shared on a lot of our materials and throughout the office. Those are authenticity, integrity, excellence, ownership, one team, and passion. And then we have our definitions below that too for what we mean by each one of those words. Those are things that we've previously committed to. So I think really we need to talk about, whether or not they belong as they are into the foundational principles here, the foundational statements, as opposed to changing the actual definitions of what you see in the boxes. But we feel like it's really important that we include this in our decision-making process, our values. Any questions or comments about including this and including it in the way that we have it written?
Just very quickly, we felt very strongly that our employees, who are really the backbone of the organization, ought to have an input in the decisions that we make on a regular basis. It's happening now. We just want to acknowledge that as one of our principles. And this is in addition to what the board originally approved back in 2012. And I suspect that back then, Vicky, when they're creating those, we didn't have any employees back then.
You didn't, you had like four or five employees probably.
Okay.
I think you had the C-suite and a couple other people. That was about it.
And that was it. And this concludes, right, Caroline?
Yes.
Okay.
So James, we're not casting any votes for guiding principles today.
No, I think we have to go back and update some of the information that some of the input with the input we received today from the committee members, then come back to the next meeting and do the votes. Mr. Chairman, with your guidance and permission, I'd recommend we do that.
I think that makes sense. You know, there was robust enough feedback to where I think we need to have another go around, but this was a very useful conversation, I thought.
Thank you. So Susan has a brief update on this is an issue that came up at the HPBQ committee meeting discussion maybe about 2 months ago. Just a quick go ahead, Susan.
Sure. Thank you, James. We just wanted to let you all know there was discussion at HPBQ just looking at the plans and carriers on the exchange and, you know, thinking about new carriers for the exchange. And so the strategy committee really is the place for thinking about potential new carriers for the exchange. And also, as James has been talking about, our plans for the subsidiary as well. So we just wanted to, you know, take a moment to mention to you, you know, that is something probably for this committee to think about, and just let you know on our end from Access Health, John Carbone is working on going to all the carriers that are out there that potentially could offer plans on the exchange, and talking to all of them, you know, to others that aren't on the exchange about any interest in coming on the exchange, and also thinking about subsidiary and strategizing for, you know, new products and carriers, as James had mentioned.
Again, this is more about having a process in place to jumpstart the process of vetting new carriers, then ultimately recommending to the board. Yeah, just an initial conversation. It was referred from the HPBQ. This item came up at the HPBQ, I think March, Susan, March or February.
Yeah, came up earlier, and HPBQ, you know, said that wasn't really something for that committee, but the thought is just that, you know, and they weren't making any recommendation, but that this is something really in the purview, obviously, as a strategy for the strategy committee. And HPBQ focuses on, you know, the QHP certification requirements and the standard plan designs.
So, Mr. Chairman, maybe you and I can have a broader conversation about what the next steps ought to be.
That's great. Thank you, James. That makes sense. Now, let me ask you, James, is there anything from today's presentation or in your anticipated agenda for the 19th that will implicate a larger presentation from this committee, or will it just be a high-level update?
It'll be a high-level update, and with a heavy focus on the broker academy.
Okay.
And the mission, vision, and guiding principles will not be going to the board until maybe out the earliest at the June meeting, after we come back to this committee with final language.
Great.
So most of it will be on the broker academy update, because by the next meeting in June, the program would have started and training would be completed.
Great. That's great. Well, thank you all. Unless there's anything further, I want to thank you on behalf, anything further from any of my colleagues on the board and on this subcommittee. Otherwise, I'd just love to thank the members of the staff through your leadership, James, for this robust presentation. I think what you see in the room is we're all getting excited that this is coming to so many heads in a strategic way. And it's good work. So appreciating you and your staff, and look forward to seeing it develop even further. So thank you, James, for that. And I'd love to entertain a motion to adjourn if we would.
Motion to adjourn. This is Grant.
Seconded, this is CC.
Thank you, Cece. Marcine, if you could take a roll.
Hugh Hernandez,
Yes.
Ron Ritter,
Yes.
Paul Philpott, Victoria Beltry,
Yes. Yes.
Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Thank you,
Thank you.
Marcine.
Thank you all.
Thank you, Mr. Chair.
Thank you
everybody.
for great work.
Everybody.
Yes.
Thank you. Thank you very much.
Work.
Bye-bye all.
Take care.
Bye, everybody.